Hi everyone, my name is Iris Xu. I'm a senior analyst in predictive analytics at Evolent Health, and I'm here today to present the work I did with my colleagues Jenny Wong and Ali Zadmir on understanding the association between social determinants of health, also known as SDOH, and health service resources with heroin overdose events. So to first provide some context for this problem, opioid use has increasingly become a major health issue in the past decade. In 2017, the Department of Health and Human Services officially declared it as a public health crisis. Current public policy efforts to address this epidemic are often clinically focused, centering around responsible use and treatment, decreasing opioid supply, and finally, overdose prevention and harm reduction. However, we also know that social needs often affect a person's health just as much as their genetic code. Therefore, we sought to explore how social needs and treatment resources influence the likelihood of opioid use. And we did this by trying to understand how these factors correlate with heroin overdose events in order to explore potential levers for intervention and guide allocation of resources. So to do this, we employed a multivariate logistic regression approach. Our data set was collected from publicly available data sources. We first extracted our outcome using the Cincinnati Fire Incidents EMS data, filtering on heroin overdose events. We use events ranging from January 1st, 2017 to the end of April 2018. From the latitude and longitude coordinates of these events, we mapped these events to corresponding census tracts using the Federal Communication Commission's Census Block API. In total, 127 census tracts in the Cincinnati region were identified with an EMS response. We then converted our overdose responses per census tract into a binary outcome by setting a threshold at the 90th percent, with 1 indicating a census tract with a response volume ranked in the top 10%. In order to create the inputs to our model, we extracted from publicly available data sources that can be categorized into the following 3 categories. The first are SDOH sources, which came from government sources such as the CDC, the Department of Agriculture, the U.S. Census Community Health Survey, and the Department of Housing and Urban Development. We also extracted data to identify prescription patterns of census tracts, and this was obtained through CMS Part D prescriber data. Finally, in order to identify treatment resource variables, we extracted data from the Substance Abuse and Mental Health Services Administration, or SAMHSA. From this data source, we were able to get information on locations of treatment facilities as well as locations of physicians who are able to provide medically assisted treatment. Feature selection started with literature review on factors associated with overdose, and altogether we created 47 variables. From there, we did feature selection and elimination through the following methods. First, by an analysis of feature correlation, where we removed highly correlated features, and second, by identifying the most significant features found through lasso regression and recursive feature elimination. In this way, we were able to reduce down our data set to 12 features, which were used to train a logistic regression model. Using logistic regression, we were able to identify 4 features that were statistically significantly correlated with our outcome. These 4 features are the estimated total census tract population, the percent of population that is minority, the percent of population that is institutionalized, and the total sum of antipsychotic scripts prescribed by physicians in a census tract. And so these results are summarized in Table 2 here. From the coefficients, we found that an increase in population estimate and percent minority decreased the likelihood of high overdose incidence. We found this interesting and supported the concept that overdose events may happen in areas that are less populated in an urban area such as Cincinnati. We also found that an increase in institutionalized population by 1% was associated with a 6% increase in odds for a census tract to be an area of high overdose incidence. We also determined that the sum of antipsychotic scripts was positively correlated with overdose incidence, where an increase of 10 scripts was associated with a 2% increase in odds. We found this to support other studies showing that mental health issues and substance abuse often co-occur. Other social determinants, such as low transportation, per capita income, and the percent of the population without health insurance, was also strongly correlated with the outcome, but did not reach statistical significance. We understand that there are a number of data limitations to our work. One is that using the EMS data, we're possibly only capturing a subset of the heroin overdose responses and using this as an abstraction for the overdose epidemic. We also, by using Medicare Part D data, that is similarly only representative of a subset of the prescription data available. However, we believe if we were able to expand this upon more geographic regions and have more availability to other prescription and treatment data resources, we can be able to have expand our findings. Finally, despite these limitations, we believe that we've developed an applicable framework for understanding how sociodemographics and treatment factors correlate with overdose events. We've also created a heat map of a sample of a tool to indicate how visualization aids, such as this one, may assist public policy experts in addressing multiple social needs and health issues. Finally, by using a combination of these factors, we've identified a way in which public officials can prioritize certain areas in which to set up resources and appropriately enable the greatest impact. Thank you for your time.